everyone, welcome to PHTV Channel 4 in Palos Heights. I'm Sue Jankowski, and today you're watching Medical Update. We're really fortunate today to have Dr. Ankur Dave. Dr. Dave, thank you for joining us today.
Thank you.
Dr. Dave comes from Northwestern Medicine Palos Hospital, and so that's right here in our neck of the woods, and we're really glad to have him here today. He is the Medical Director of Infection Prevention at Northwestern Medicine, and we're so curious about a lot of things. Of course, high on everyone's mind is COVID and monkeypox, and that's primarily what we're going to discuss. However, I'd like to find out a little bit more about you, Doctor, and how long have you been in the area, your area of expertise? Just give us a little history of your background.
Yeah, sure. So I've actually been a local person. I grew up, went to St. Lawrence for high school, and did my residency over at Christ Hospital. Then I went to Loyola for my fellowship for infectious disease. And then I've been with the Southwest Infectious Disease Group in Palos for about 5 years now, a little bit over 5 years. And then I've been in my current position with, the Infection Prevention Medical Director at Palos, now part of Northwestern Hospital, for about 4 years now. And so, along with treating patients with infectious disease, I help oversee hospital, spread of infections, mainly in the hospital as well. So that's kind of my background.
Okay, well, I feel like your area of expertise has certainly been tried and put to the limits in the past couple of years. And, that has gone through so much. We had someone come in here and talk about a nursing program, and they talked about, the fact that there's so many facets and there's so much need for medical professionals at this point. You probably find that too, that within the hospital, there's a need for a lot more people than we've had in the past, primarily because we've had COVID, huge, and now we have monkeypox. So if you could give us a little bit of information on how is the hospital responding to these diseases now. Let's start with COVID, because that's still, everyone's like, oh, the pandemic's over, but it isn't. I mean, I think we're hopefully out of the terrible part, and we've gone to a part where we're kind of plateauing a little bit. But tell us about COVID at this point.
Yeah, so I always joke, like, had I known there was a pandemic coming, I would have maybe picked something else. But,
yeah, I don't blame you.
Not really, but I mean, I joke around with that.
Sure.
But yeah, the past 2 years obviously have been challenging, especially in the healthcare field.
Yes.
We've gone through a few different waves of COVID, and they kind of had a different flair. I mean, currently, things honestly look good in the sense that, like you mentioned, the cases have plateaued. The best thing that we're noticing right now is the hospitals aren't getting overwhelmed. In the past, when the surges have happened, there's been a lot of hospitalizations, a lot of patients in the ICU on the ventilators, and at least this summer, the numbers are up, but the hospitalization numbers, particularly, have not sort of been as bad as they were, in the previous couple surges that we've had. So that's, I think part of it's vaccines are playing a huge role. Now we have new oral antibiotic or antiviral medications that people can take, and I think all that's protecting patients and preventing them from getting very sick so that they need to get to the hospital. So I think that's, that's sort of the difference going on this time. Mm-hmm. Obviously the numbers haven't quite surged to the rate that they had in, end of December into January. So we kind of have that to see how that goes, but currently things so far are, like you said, are kind of steady and plateaued.
So you have seen, and the general feeling of the medical professionals are thinking that vaccine has prevented the disease from being as significantly disastrous to people.
Yeah, I think it's definitely protected the more vulnerable population as well. And yeah, I personally think that, people are, it's vaccines, they were studied to see if they would protect you from getting severe disease. People kind of sometimes misunderstand that, oh, why I got the vaccine, I still got COVID. Well, that's okay. You can get COVID. It's, you didn't end up in the hospital on a ventilator.
Exactly.
And so that's sort of what people sometimes don't realize. And I think that will continue. Obviously, the wild card, this virus is, always mutating, and so there's all these variants out there. Unfortunately, that's something we can't predict, and we won't know until, we thought we were done, and then Omicron happened. So these variants, once they emerge, are sort of the challenge moving forward. But I think the vaccine that we have now is holding its own currently, and there's some talks about having like more variant-specific vaccine coming out in the fall.
I heard that.
So we'll kind of wait to see what shakes up with that.
I heard this newer variant, there's always one around the corner, is not, it doesn't, it's kind of like a bad cold. And I know that Omicron was a bad cold for a lot of people. But this is kind of getting to be a little less of a bad cold. Are they, from your research, is that kind of true about that happening? Yeah,
we can't, it's hard to say, like, is it just a bad cold because of everything else that we've been doing? Or is it just a bad cold because, the virus is just not that dangerous? We do know it is, more easy to spread this virus, and more people can get it, and they get, so it's easier to catch the virus. But like I mentioned before, we're not seeing that surge of patients coming into the hospital.
That's great.
Which is great.
So what should people do or continue to do to protect themselves against getting this virus or any other thing that is coming down the pike?
It's kind of going back to the basics, washing your hands and all that goes a long way, stuff you learn in kindergarten, don't put your hands in your mouth. So that actually goes a long way to protect yourself. Now, what I will say is, like, patients who are immunocompromised, if they've had a transplant, they're on medications that suppress their immune system. If they have, for other reasons, if they have autoimmune disease and they're on medications that suppress their immune system. So in those patients, the patients that I'm seeing in the hospital now who are actually sick from COVID, is those patients that we know don't respond as well to the vaccine.
I see.
And so for those patients, I would, currently, technically we're still at a high rate of transmission and locally. And if you have those high risk factors, I still think, a mask is probably a good option. But for people who are otherwise healthy, just regular common stuff, if somebody's sick, just stay away from them as much as you can. Sometimes it's hard to avoid with kids. I've got two, and when they get sick and they come home, everybody in the house gets something.
So right.
But the old things that we've learned, try to, when you cover your mouth when you cough or sneeze, wash your hands, and all those still go a long way from protecting you.
They do, and I think everyone was so diligent when things were horrible and really rough. I didn't step 2 steps into my house without scrubbing my hands and, all of that. And now I have to remind myself to do it. So, if we keep up those practices, that certainly would be beneficial, especially coming into the winter season when we're all going to catch something eventually.
Right. It just happens, right? I think part of it is just because we're more in a close area. We're not outside as much, so more gatherings happen closer instead of like, we'll get together in the backyard outside, grilling and all that. Now we're all on the inside, the holidays, and even before, like I said, when kids go to school, they all get together in a classroom, and then they spread germs, and then they bring it home, and everything else. So that's something that we always, that's typically why we have flu season and other viruses that go up around that time. And that's actually been true about the COVID virus as well. Like in the past, we've had, these peaks that surges happen are usually in the winter, fall into winter time.
I understand that's definitely true. How's the hospital? Have they changed anything they do because of COVID as far as protection?
Yes and no. Obviously the past 2 years it's been a learning process, and as the CDC and we get new data available to us, we adjust. In the past there was always this concern about how to isolate people, how's COVID spread, and all that. So I think at this point things haven't really changed a lot now, but we've kind of have a good handle on how to isolate people who have COVID, so we protect them and we protect the staff and we protect other patients who are there as well. Okay,
we were just talking about the hospital per se. So let's talk about coming to visit someone at the hospital or just coming into the hospital. If you're a patient or visiting a patient, has the procedure, the protocols changed at all, or are they the same?
For it, I mean, it's obviously a little bit different than before COVID, right? Before COVID, there wasn't as much screening. So now, if you're coming to visit a family member in the hospital, coming in, you're going to get screened. You're going to get asked if you have any symptoms, if you have any fevers, cough, regular COVID symptoms. And if you don't, then you're able to visit. The difference is when you visit somebody, when you're in the hospital, you're still required to wear a mask. That's something that has not changed from hospital to sort of in the community. The mask mandates and all that have been lifted. In the hospital, we still recommend that all the visitors and even the patients wear a mask.
Yeah, that makes
Especially when
sense.
they're traveling around, let's say if they're going for a procedure or a test or something. When they're by themselves in their room, they don't necessarily have to wear the mask. But let's say if a nurse is coming in or something, they're required to wear masks.
Yeah. Okay, that makes sense. Okay, let's switch a little bit to. Well, actually, I have one more question about COVID. Now we got kids starting back to school.
Yes.
And now the big debate. Kids wearing masks, kids not wearing masks. Some schools are saying no, some schools are saying yes. And we don't want to see kids get COVID. I know a lot of kids have been vaccinated at this point, which is great, but not everybody has.
Yeah.
So is that sort of, is your feeling that this is left up to each school district to do what they want to do? Is it more of a parent thing? I mean, is it really necessary? I guess wearing the mask for a child is it's not that great.
Yeah, no, I mean, I understand. I always kind of struggle with this, right? Because I have a 2-year-old and a 5-year-old. And it's really hard to, get them, especially if the other kids aren't wearing it, right? So like, hey, they're not wearing masks. Why do I have to wear a mask and all that? So it's kind of like, I mean, in my opinion, it's kind of like uniforms. It's always good to have sort of a similar policy so that the kids don't feel left out or don't get confused. It's really hard to regulate that because, everybody's health problems are different. Like if you have a child with asthma, well, if him getting COVID or her getting COVID will be a lot different than somebody who's otherwise healthy. Full disclosure, both of my kids had COVID, and I think they go to daycare and nursing, and thankfully they did fine. My 2-year-old, this was before she was able to get the vaccine, and my son had the vaccine, and their course thankfully was very mild. They had a cough and fever for a few days, but unfortunately it's hard to predict, and that outcome's not the same for everyone.
It isn't.
And so it's always challenging to sort of make that balance of how to protect people, but also they're not comfortable, they're cumbersome, and they're kids, right? Like they
Especially a
if it's
2-year-old.
here,
Oh,
and they
yikes.
it's hard to do that. So I think it's a challenging question to answer.
It is. I know. And some parents are really, very. It seems like there's two sides. Parents who are like, you must wear a mask, and others that are like, it's not going to matter.
Yeah.
It's tough. It's a tough call there.
Yeah.
Yeah.
Yeah,
So.
and unfortunately, I don't think I've even personally have come up with the right answer
No.
for that.
Well, that's the problem. I mean, really, for a lot of school districts, parents and teachers, everybody, what is the right answer? I think there isn't one.
Yeah, the concern is, so again, you could look at where things are. In my opinion, like anytime the hospitals are starting to get overwhelmed, anything we can do to help that goes a long way. And I think, currently, I think that's kind of how we're approaching it, and I think that's been working. Kind of going back to your thing with, the hospitals sometimes being short-staffed and all that. If you get sick enough where you need to be in the hospital, you want people to be there to take care of you.
Sure do. Yeah.
So I think that should play a huge role into how they approach this.
Yes, exactly. Okay, then the other big question right now is this whole monkeypox that's coming up. It's a great name. And, it's scaring people. And I guess, how do we avoid it? How do you get it? I mean, I don't know very much about that.
Right. So monkeypox, basically, it's a viral infection, and the biggest thing it does is it causes skin lesions. They're not comfortable, they're painful, and it comes with any other viral illness. You get like fevers and headaches and things like that. The way it's spread is most of it is through very close direct contact. So if somebody has monkeypox, they have the skin lesions, you come into direct contact with those skin lesions. That's how you get it. It's obviously thankfully not nearly as contagious as COVID.
Okay.
And as you know, at least during this, and there's actually a smaller outbreak in 2003 of monkeypox in the U.S., nothing to the scale that we have now. In that time and during now, like we haven't had anybody die from monkeypox. The issue, and right now we're seeing more of it in a certain community where it's, I guess they're saying it's sexually transmitted, but it's like anybody with close contact with somebody with monkeypox can get it.
So those lesions, you said they were painful, and I actually did hear that part of it, that was very painful. Yeah. And is that the first indicator that you have something like that?
Typically, yes. I mean, the lesions are going to be the most telling whether you have it or not. Prior to the lesions erupting, sometimes people can, like I said, they have like a fever, they feel tired, they feel weak. But that, you know, a lot of things can cause that. But the lesions are pretty characteristics of it. They're kind of like raised. They almost look like pimples. And you know, obviously testing it would be the best way to tell, but that's sort of monkeypox.
Okay, so to avoid getting monkeypox, then it's not airborne. You've got to have direct contact with someone with it.
Yeah.
And so if you know someone with it, what's your advice?
You just stay away from them.
That's what I would think too.
Yeah.
Don't go there. Just stay away from that person.
Right. Intimate, close contact is, you know, obviously don't do that.
Would they be contagious prior to, like, the symptoms of like a fever, aches and pains, or the lesions? Would they be?
Yeah, usually not until the lesions appear. So usually it's close contact with the lesions is what typically happens.
Okay.
Having said that, like sometimes you're not aware, you know, like if it's really early and you can't see the lesion, because you can sometimes get like genital lesions, you're not aware of that. Mm-hmm. Or very rarely you can get like lesions in your mouth, like oral lesions and stuff like that too. So if if you can't see it or not aware of it and you have incidental close contact, that's
I see. So that would make it, okay. So these lesions, when they go away,
yeah.
Do they leave a remaining scar? Do they heal up?
They heal up. They can leave scars.
Like chickenpox? Yeah.
Kind of.
Okay.
And again, so like once, and that's when you're not contagious, when all the lesions are healed up and when they've scabbed up, you don't spread the virus anymore.
Okay, so who would be most at risk? I mean, this sounds like such a specific contact you have to make. For the most part, you might notice that person has some sort of lesion, except for the examples that you gave that you wouldn't know. So how can we avoid getting monkeypox, I guess?
Yeah, I mean, again, so currently we're seeing more of the cases in the LGBTQ community, but like I said, it's because, I mean, it's not because of the community, it's just because that's where the virus is currently. And other than avoiding, you know, people who have monkeypox, there's really, you really can't get it unless, or it's really difficult for you to get it unless you're in contact. So that's why right now, like the testing and all that's been focused is more for people, you know, if you've had contact and with somebody who's had monkeypox or somebody who's had lesions. Like I said, for some people, the lesions might come and go, and it's, you know, it's very transient, and they might not have noticed it. But then they can spread it to somebody else. And even in this one, like how your immune system matters. So like people who have, for one reason or another, their immune system's compromised, well, they're more likely to have a severe disease, and they're more likely to spread it to other people.
Okay.
So, yeah.
It doesn't sound like this has the ability to be spread as widely as COVID. that's airborne and we're all together breathing, and that seems much more dangerous to get.
This seems much less, I mean, it's much less contagious than COVID.
So I'm just saying, and this is just me talking, I think people could be less worried about monkeypox than getting COVID, it sounds like to me.
Yeah, I mean, again,
most
people, they haven't, like I said, at least so far that I'm aware of, I don't think anybody's died from monkeypox. It's usually you get secondary complications. So let's say you have these skin lesions, but then you get a skin infection with the bacteria on top of that, or something like that is typically what causes, the troubles.
Well, nobody wants to be sick, that's for sure. So
exactly, and I mean, it's not. From what I understand, it's not fun or comfortable.
Oh, no.
It doesn't look great either.
It sure doesn't. Wow.
So you definitely don't want it, but if you get it, it's kind of not the end of the world.
Okay. And so at the first sign of any of these things, whether it's COVID or monkeypox, what should you do?
You should definitely call your doctor. So for those who have like a primary care doctor, there's a lot more that we know what to do with COVID now than, obviously monkeypox. There is antiviral medicine that was more studied for smallpox, but the virus is so closely related that they think it would be beneficial. It's available through the Illinois Department of Public Health. And then there's a vaccine for people who are in close contact, so, who haven't developed small monkeypox. That they can, reach out, and the providers can reach out to IDPH and figure out ways for the patients if they're interested in getting that.
Okay.
Well, and there's also testing, for the monkeypox and
testing.
COVID,
So you want to know.
Yeah.
So you can isolate yourself and not spread that as well. Okay. Well, that sounds great. And is there anything else you would like our viewers to know about either COVID or monkeypox or any other virus that's going to happen? Get your crystal ball.
Well, yeah, exactly. If I had a crystal ball. But I mean, I think there's a lot of information out there, and people, rightfully, they're like, I don't know, this person's telling me this. I read this over here. I still direct my patients and everybody who really wants to know to the CDC's website. I think their website is good, and especially for, they have it in simple languages for people to understand, and go from there. So if you have a lot of questions, you're not quite sure, I think I usually direct them to that website. It's so they can educate themselves.
Okay, that's really good to know, because there's a million places to look up things nowadays, and which one is the right one. So the CDC website is one you would recommend.
Yeah.
Okay, great. Well, it was so nice having you here today, Dr. Dave.
Thank you.
And thanks for giving us a little bit of your time and giving us a little heads up on COVID and the monkeypox. I hope we made it a little clearer. Dr. Dave made it clearer to you. Some things to avoid doing, and the status of COVID and monkeypox. Thanks for being with us today.
Thank you, guys.
Thanks for watching us on Medical Update.